Unusual cause of dysphagia. By Venkatraman Indiran via Tzu Chi Medical Journal, 2018-33. Venkatraman Indiran, Suganchand Rikabchand Sunil Kumar, Prabakaran Maduraimuthu. Tzu Chi Medical Journal 2018-33, 193-193. A 55-year-old man presented with complaints of an acute-onset dysphagia. He had a history of hypertension with a blood pressure of 130/90ths of a millimeter of mercury at admission. On examination, he had a hoarse voice, reduced palatal movements, and loss of gag reflex. Magnetic resonance imaging, MRI, of the brain 6 hours after onset of symptoms showed a small acute infarct in the left hemimedulla and a few other chronic infarcts in the right gangliocapsular region and bilateral thalami. Figure 1. Figure 1, axial section on magnetic resonance imaging of the brain. A. D2 weighted and B. D2 fluid attenuated inversion recovery weighted images show a small acute infarct in the left hemimedulla, arrows. Wallenberg's syndrome or lateral medullary syndrome is caused by ischemia in the territory of the posterior inferior cerebellar artery or vertebral artery. Swallowing centers, which are located in the rostral dorsolateral medulla, may be involved in lateral medullary infarction with resultant dysphagia. 1. Wallenberg's syndrome usually presents as vertigo, dysarthria, nystagmus, Horner's syndrome, diminished gag reflex, ipsilateral ataxia, and decreased sensation on the contralateral side of the body. As the bilateral medullary centers for swallowing function in an integrated manner, even a unilateral medullary lesion may affect the pharyngeal phase of deglutition and cause significant dysphagia. Hence, Wallenberg's syndrome should be considered in the differential diagnosis of sudden onset dysphagia. MRI of the brain should be done to exclude this syndrome.